blood cancer is not caused by any blockage or obstruction in the blood flow. It's a disease where the cells that make blood become abnormal and grow uncontrollably. Let's see how normal blood is made. All blood cells, red, white, and platelets, are produced in the bone marrow, which is a soft, spongy tissue inside bones of hips, ribs, and spine. There is one master cell in bone marrow called stem cell. These stem cells produce three main types of blood cells: red blood cells, which carry oxygen and keep body energized; white blood cells, which fight infections and protect body; and platelets, which help in blood clotting and bleeding. Inside bone marrow, stem cells divide and produce immature blood cells. These cells grow and mature into RBCs, WBCs, platelets. Mature cells leave bone marrow and enters blood circulation, live for fixed time, then die naturally. But in blood cancer, the DNA of blood-forming cells in the bone marrow gets damaged. These cells don't mature properly, they don't die when they should, and they multiply uncontrollably. All blood cancers start in bone marrow, but differ based on which white blood cell becomes abnormal and where those mutated cells accumulate. Three common types of blood cancers are leukemia, lymphoma, and multiple myeloma. In leukemia, stem cells in bone marrow produce abnormal, immature white blood cells. These cells don't work properly. They spill into the bloodstream, resulting in too many useless white cells floating in blood. Due to this, normal cells, RBCs and platelets, count in blood decrease, which results in anemia, frequent infections, bleeding/bruising. Acute leukemia, which involves many immature WBCs, is fast-growing cancer, and chronic leukemia, which involves more mature but abnormal WBCs, is slow-growing cancer. In lymphoma, a specific WBC called lymphocyte becomes abnormal in bone marrow. When these cells spill into blood, it forms solid tumors in lymph nodes, mainly around neck, armpit, chest, abdomen. In multiple myeloma, plasma cells, special WBC that make antibodies, becomes abnormal in bone marrow. These cells overgrows inside bone marrow itself, crowds it, and damages the bones and immunity. Globally, out of 54 million people are living within 5 years of a cancer diagnosis. 4 million have blood cancer. Of these, 58% are men and 42% are women. Out of every 10 blood cancer patients, about 6 are men and 4 are women. Causes of blood cancer are genetic mutations, changes in DNA of bone marrow cells, usually not inherited, radiation exposure, like atomic exposure, radiation therapy, harmful chemicals, benzene found in fuel, industrial chemicals, and viral infections. Symptoms of blood cancer are extreme tiredness, feeling weak all the time, even after rest, frequent fever or infections, unusual bleeding and bruising, unexplained weight loss, lumps in neck, armpits, chest, abdomen, night sweats, and shortness of breath. Blood cancer begins quietly within the bone marrow, flows through the blood, and reveals itself only when the body is too tired to fight alone. Thanks for watching. Like if you found this meaningful, subscribe for more, and share your thoughts in the comments. Take care of your health, because not all illnesses are visible at first. Early signs matter more than we think.